Hello, good morning, and welcome everybody. I'm Scott Warren. I'm Vice President of our AWS practice for North America in Capgemini. And we're excited to have our partners at Baptist Health South Florida here on stage with us this morning. So Baptist Health is undergoing a digital transformation powered by the AWS cloud, really with the outcomes of improving agility, increasing security posture, reducing tech debt, and most importantly, improving patient experience, engagement, and care for the patients. So thrilled to welcome Tony Ambrozie, Chief Digital and Information Officer at Baptist Health, and Deepu Kumar, Chief Technology Officer at Baptist Health, and they're going to kind of walk you through how they're approaching this digital transformation out on AWS and some more details about the expected outcomes. So happy to turn it over to Tony and Deepu.
Thank you. Actually, that was a great summary, so any questions? All right. So good morning, thank you for coming. When we were invited, whatever that was, first discussions earlier this summer, I think, we thought, well, who would be interested in hearing what we have to say? But I guess there are people, so thank you for coming. Let me see. All right, so I'm Tony Ambrozie, the Chief Digital and Information Officer at Baptist Health. Before we go into who and what is Baptist Health, a little bit of a story. And Deepu is like, oh no, another story. All right. So I joined Baptist about 15 months ago. So since then I had, I've been speaking on panels and getting this two questions. Number one is, what were you thinking when you joined a hospital system in the middle of a pandemic, a 100-year-old pandemic? And the answer to that is, when else you join a place in an industry, more than a place, an industry, that needs so much transformation than during a pandemic, all right? Because the pandemic drives the opportunity for transformation. I don't know if you remember, maybe it was mentioned here, in the first 2 months or whatever it is, first 5 weeks of the pandemic, the entire economy evolved and the worth of 5 years of digital transformation. So I said, this is it. If not this time, when else? The second question I got asked is, wait, you came from Disney. So I was doing technology at digital at Disney Parks in Orlando. Now you're moving to healthcare. What's the connection? Other than writing mobile apps. And the connection is the following. Clearly, it's really the consumer centricity. And obviously with Disney and prior to that, I was with American Express. That's the intense focus. It's all about the consumer. It's all about the guest. It's all about their experiences, and even before they come and definitely after they go, and how they consume the products and the services, all about consumers. Now, on the healthcare side, and I talk about in general in terms of healthcare, the industry, the one that most of us here, I don't know if there's anybody who is a physician or a nurse in the audience. If not, we're all patients and consumers. Obviously, on the medical experience side, superb. You go there, you're taken care of. But going in and coming out and interacting in between is probably a bit problematic, I think you would agree. How you get appointments, how you get the news about your updates, how you get results, all that stuff is somewhat problematic. So, Baptist, the board, about maybe 2 years now, they decided that digital and the digital transformation is going to be super important for the success, long-term success of the system being the hospital system. Actually, the CEO, Brian Kelly, who's a visionary, he keeps saying that he believes that by far digital and what we're doing now, we're going to do continue to do is more important than the pandemic itself. Sure, it's of a different kind, but it's really, really important. And they came even before I joined with this mantra of being the, should I say that out loud? The Amazon of healthcare in South Florida. There you go. And what else, we can say about Amazon that other than this consumer focus, a relentless consumer focus. So this is really the why. We're going to talk a little bit more about the details. So Baptist, South Florida, not that Baptist, not the other Baptist, not the other Baptist. So we're in South Florida. A funny story, about 2 months after I joined. So I started 1st of October. In maybe even less, November, I get a call from a recruiter and says, he says, I was retained by Baptist to hire a new chief digital officer. So I said, wow, my boss is already thinking of replacing me. In reality, it was the Jacksonville Baptist, not our Baptist. Yes. 11 hospitals, a lot of outpatient centers, and we're going to talk a little bit about how the technology, not just the, let's say, IT technology is driving that change. 23,000 employees, another 10,000 associated folks, 4,000 physicians, a lot of visits per year. One of the great things about it, listed one of the best places to work for quite a number of years. And as I said, I was brought in for the digital transformation. So what exactly does that mean? Because we are talking about the digital transformation. What you see here in this list is really how an IT organization, technology organization would describe what's happening for them. They're asked to do things faster to market, better security, so on and so forth. But in reality, the driver for the system is much bigger. And it's a challenge on the business side that drives all this work on the technology side, on the digital side, and therefore the cloud part. So let me explain why. A lot of changes, not just in the healthcare industry, but across the board. But in healthcare, a lot of pressures, constant cost pressures. We need to get more, and I'm talking about the industry, we need to get a lot more efficient. We're spending $4 trillion per year on healthcare. We need to make sure that we're getting what we pay for. A lot of influences, regulatory influences, regulatory pressures, new entrants into the marketplace. Do I mention Amazon? Again, Amazon Care. So a lot of drivers of change there. But also we were talking about consumer centricity, also that expectation of the consumers and the patients that they interact with the healthcare and with us in a very different way than they used to and they currently are, right? And again, we're all consumers and patients. It is about having more control over the process, a lot more information, a lot more say, a lot more advanced the notifications, things being much simpler than they are, much more straightforward. Clearly, healthcare is a very complex arrangement where the customer, unfortunately, sees all that complexity between the hospital systems, the payers, the insurance companies, and all the other players, whether it's the government or other entities. It's complicated. And so therefore, there is an expectation that how they interact with us will be different. All right, so that's kind of what's driving the need for a business change, then in turn drives the need for a digital transformation change. And digital transformation is really a business transformation with digital tools and technologies and experiences, right? It's not something in itself, but it's something that is done for the business and in a continuous manner. That digital transformation drives digital, in principle, digital experiences, digital capabilities, which in turn drive technology changes. So it's a little bit layered. For me, the basic is pure technology, then digital experiences, and then on top of that is the business transformation, if you want. By the way, if you have any questions, feel free to interrupt and I can address. All right, so this is where I've done that transition from the bigger picture is what's changing in the industry that will influence us and influence the digital and influence the technology. Then let's talk about cloud. So why cloud? Well, let me do this. Let me take the one thing that we all appreciate that is not the most important one, but is the one that gets us the support of the CFO. Let's take that out of the conversation. Well, because let's address it first, and then we can take it out of the conversation. And that is the cost. Right. And there are two elements there where cost per unit of processing, however you want to measure it, will eventually continue to be cheaper than the normal average on-prem implementations over time. When you factor in, yes, you buy those things over time, some of them may be depreciated, but at some point you need to buy new ones, and managing a whole data center, all that stuff is expensive. So per unit of processing, it is cheaper when done properly. Now, the trick is the following. If it's not managed, the consumption is not managed, it will explode. Because now it's, 2.5 minutes to create an instance versus, I don't know, a week or two or a month getting a server in on-prem. Clearly, if you don't manage properly, the cost will balloon, even though the cost per server is going to be smaller. So, but that can be managed, absolutely can be managed in some shape or fashion. So, now that we've put the cost aside, what are the things that are valuable about cloud that drive all this conversation? And I'll start with, and I think here we call it innovation, but what I'd say is it gives us the opportunity to do things that will be very difficult from a capability perspective, functionality perspective. That would be very difficult to replicate and certainly much longer to replicate in on-prem. And simply put is the cloud is not a Jeff/Andy/Adam server versus my server. It's an ecosystem. This is Jeff Bezos, Andy, and Jazzy. It's an ecosystem. So all those capabilities, we've seen yesterday a bunch of stuff on the data side from Amazon, the marketplace that exists, where it's easy to pull things. All that stuff will be very hard to build long-term and maintain, especially for a system that is not very, very large. Of course, if you're Apple, if you're Facebook, you do it on your own, but everybody else are much more problematic. So that's the innovation, but it's so very important, because for anybody to be able to do all the things that are available in the cloud, imagine the deploying Snowflake in the data center. Seriously? Like, that would be crazy. All right. Now, the second part is that left side of that wheel, which is capabilities on the quality of service side, on the infrastructure side, on the technology side, the ability to scale up and scale down. The higher availability and higher reliability. And clearly, we were talking earlier about the agility. How can we do things a lot faster? Because we can. And a lot of things there on that side are because of the automation that the cloud providers, not just Amazon, all cloud providers provide, all that automation of all kinds, that's where the huge value is, and it's certainly for us. A little bit of a story, I joined Baptist, and there were no plans for cloud. It was very complicated, and they said, no, it's not going to work for us. And I said, well, probably it will work. Based on my experience coming from a digital transformation and a cloud migration in my previous life, definitely will work. So let's start, and we're going to see in a moment how we planned and we prepared for that transformation. But guess what? New capabilities, new products started showing up. They required cloud even before I was ready, let alone the rest of the system. So that's the kind of an interesting thing about if you're not moving towards where the change is, the change will come to you when you're not prepared. So you better be prepared. All right. Okay, so now getting into a little bit on the migration approach. The way I would say it is the following, and we were talking about with our AWS friends yesterday, is really a basics of cloud and cloud migration, taking the stuff we have and put it there. But then obviously the next level will be to use all those good things, goodies, at least on the functional side that the cloud provides. And so how do you how do we think about doing this transition? Well, it's a change like any other. Of course, a lot of technology involved, but really a change like any other. So you start with what you have. What is it that you have? And this, depending on the industry, can be extraordinarily diverse. Maybe it's all custom developed apps, relatively modern, and therefore you can just move them. Container here, container there. Docker container here, container there. Or on the contrary, maybe you have mainframe. That would be a lot more complex. But so you need to understand exactly what you have. Or the other side, the other extreme is you need to decide, or we needed to decide what exactly do we want to have at the end of this journey. Because you can go full-blown, as you know, some of the consulting companies, no pun intended to anybody, have been suggesting on going full cloud native, that is rewriting everything. And that can be done, but it costs a lot of money and takes a lot of time. Or you just move everything as is in a shift, and there's still a benefit. There's still a benefit, or somewhere in between. So you need to decide, and at least that was our approach, what exactly we wanted to accomplish at the end of that, say 2 years, 3 years. And then with those, and do 2 points of figuring out how you get from A to B. All right, a little bit more detail here. So again, the snapshot. What is it that we have? The inventory, the data, the applications, the networking, the latency requirements between applications, SLAs, what needs to be where, what needs to respond how fast, so on and so forth. And then there's that process that we call discover and organize that basically is based on what we discovered and based on what we need to do, we want to end up with. And based on what we call the reference architecture for the cloud, that is, what would we like applications and systems to look like when they are in the cloud? What is the standard? What is the topology? What are the products? So on and so forth. That kind of leads into what you're going to do for each. And again, as I said, there's going to be a combination of things. From hey, as we were going through that inventory, we discovered that we have a bunch of things that we don't really need. So let's retire them, or let's consolidate them with something else. I think in any place that I know, that's probably 10%, 20%, sometimes surprising. And then, a combination of other things move us, shift to the cloud. Maybe if it's a vendor product, then you get a SaaS from the vendor. That's also a re-platform. At the very end, at the very top, is the refactor. That is, you rewrite this. To some degree, you rewrite it. So that would be kind of the process. And a little bit more in the detail about the migration model. Do you want to take it from here? All right, so as we get into the meat of this thing, I'll let Deepu drive this. I'll try to get on that little chair over there.
Thank you, Tony.
Thank you.
Yeah, I think it's no different than what just Tony mentioned. We go through the application inventory, we do the rationalization. We bucket the applications, identify what falls into the vendor application list, what falls into the custom application list, and what spectrum does it fall? Can we do it if it's a vendor application? Is there a SaaS offering from the vendor? Can we use the SaaS offering? Is the vendor offering a platform as a service? Do they have container strategies? So go through that, make the rationalization, bucket it up, group it up, and then leverage whatever the approach it is to migrate the application. And again, the key factors of success, building on what Tony outlined before, it's essentially getting to a point where infrastructure operations becomes seamless. We have centralized version controls. We know what we have, and to a greater extent, eliminate technical debt from infrastructure. All right. As Tony outlined before, the drivers for moving to cloud were multifold. We had different rational reasons why we had to adopt a cloud-first strategy. The major differentiator, because we are a traditional healthcare organizations, and some of you, most of you, many of you know the state of technology within a healthcare footprint. The major differentiator, hence, it's not we are using these technologies. It's essentially how we got to that decision, how we got the buy-in to be able to do cloud first. The use cases themselves, what solutions we use to power those use cases, they are not groundbreaking in any means. If any of you were to start building those capabilities today, you would use the same solutions what we are going to talk through. All right, I don't think it's any surprise we start with security in today's day and age. While most of the traditional on-prem infrastructures, we are able to improve the security posture, leveraging new tools, frameworks, whatnot, we wouldn't be able to get where we want to get to, because there are foundational changes that are needed, the way the infrastructure is laid out. So from that perspective, if we were to get to in-depth defense, enforce principle of least privilege, it would be foundational changes that you have to do in your existing infrastructure. Right? So it would consume a lot of effort and cost. What does defense in depth means? It's essentially going through the layers in your architecture and enforcing security and defense controls. The traditional outlook in terms of AVs and firewalls are the be end of security has long gone. Sorry. Principle of least privilege is essentially you start with no access or least amount of access that are needed, instead of grandfathering in all administrative privileges from the get-go. And then again, as a byproduct of cloud, we get well-rehearsed, well-documented a disaster recovery strategy.
Before you go, if you could go back one slide. I wanted to reemphasize what Deepu just said. So if you look at these things, the defense in depth and principle of least privilege and all that stuff, we've known and we've done or tried to do this for 20 years or more, right? So what are we talking about it? Here is two things. It's an opportunity as you move to go and make sure those things are happening, with new technology and new structures. And yes, the firewalls, the idea of the network being secure because it's behind us firewalls, no. But this is the opportunity to relook and to say, since you did all those things, for example, least privilege, is that still the case? Or do you have thousands of people who have access to things that... Now, normally a good practice is to do that all the time, but this is certainly a moment for, this moment of transition to look at those things and make sure they're done. Now, of course, the technologies are a lot better in the cloud if you want to use them properly, and we're going to show in the next slide. And so that's an additional benefit.
Yep.
Yes?
Quick question. You, on one of your slides, you had KPIs, time to deliver and time to value. As far as your KPIs, what the time to value one is an interesting one. What's the difference? I wanted to ask a question. What's those two KPIs that you talked about? Just talk about a little bit about that.
So let's go back. So time to deliver, you know what it is. It's essentially how much time you're able to churn in new capabilities. Time to value is how long. So a capability in itself may not be complete in the first go round. You may have a series of feature sets that are making up that capability. So the time to value is how long it takes for you to realize value for that initiative, right? So you start with a small and then you iterate it through. By the end of that time, how long is it taking for you to deliver that value, what you are forecasting for that product?
Is that different than KPI for delivery?
It is. It is, because it's looking at that product end to end rather than individual feature sets within that product. So these, I'm not going to go one by one into these tools. You guys, as much as I do or more, know what these capabilities provide from Amazon perspective, or the tools provide. The beauty here is that these are not disconnected individual capabilities. These are integrated, well-integrated solutions that will build up what the use case you have. For example, we spoke about a principle of least privilege. Now, that's where the IAM and Cognito comes into play. You can get to the fine-grained authorization needed for the resources that you are building. We spoke about defense in depth. That's where Shield and the AWS firewall and all that fun stuff plays a role. So that's the ecosystem, integrated ecosystem, gives you the flexibility that otherwise you wouldn't have. Another use case what we have is we follow a 3-to-1 backup strategy. And with AWS, we were able to, we were able to leverage AWS for our offline. Also, air gapping with all the ransomware news that you hear every day, air gapping became one of the core needs. And that's where S3 and Glacier helped us with respect to providing that capability. When the pandemic started, we started noticing one thing, the amount of no-shows and cancellations for appointments were increasing. So the mode of communication, or the primary mode of communication being phone, people were either not answering the phones, or the number themselves, because of the spoofing what exists today, the number themselves were being marked as spam. So while the facilities were making the call, the patients were not answering the calls. So along with chasing the carriers, so I'm sure, I don't know how much you know, to mark a call or a number as spam, each carrier uses their own data stores. So it's not a central place where the number gets marked as spam. Each carrier has their own data stores. So along with working with the carriers to validate our numbers, it was becoming clear we needed a multi-channel capability. So that's what we did. We developed a multi-channel communication strategy using AWS Pinpoint that the contact center can use email or text to communicate with the patients. This was ideation through implementation was done in 30 days, leveraging the tools we have in AWS. And it's proving to be a great help with respect to that communication. So you can imagine, we have a cancer institute, and if the facility is trying to reach the patient for an infusion and they're not able to reach the patient on time, you can imagine the impact that's going to have on that patient. Digital capabilities. So Tony mentioned the transformation and the onset of digital tools that we are bringing into the ecosystem to facilitate or ease consumer access. We are starting the transformation looking at the consumers. So how do we ease access to care for the consumers? So with that, our mobile app, which is the primary entry point or the front door for consumers, we are enriching and enhancing the capabilities there. That would be the single point for patients/consumers. If you want to browse locations, to take an appointment, to view the results, to talk to the provider end to end. This is a completely cloud-native application built in AWS, leveraging most of the EKS and gateway and end-to-end capabilities within AWS. The Digital Smart Room is another initiative which is for inpatient experience. When you're admitted to the hospital, how do we enhance your experience there? So this provides a list of features where knowing your care providers, to knowing your education content and taking your education content, to watching entertainment content, video conversing with your friends, families, ordering meals, and so on and so forth. So the platform, as well as the integration engine that powers the capability, is hosted in AWS. Similarly, for the telehealth platform, which is essentially our virtual care, both from a consumer to provider and provider to provider capabilities. So these capabilities are not something that Baptist invented. This exists today. The difference here is the speed at which we are able to churn the capabilities out. So we have a release almost every 2 weeks with new feature sets, new capabilities, and whatnot. There was a use case, I'll take an example. There was a use case for scanning driver's license as part of our registration process. We looked at some of the OCR capabilities, but it was error-prone. And it was forcing the users to scan I'm sure you have gone through that, where the picture is not right, it's not reading right, it reads something, it reads wrong. So we had to pivot to a different solution where we take the picture and we use Amazon Textract to extract the data out of the picture. So you can imagine if we were on-prem, I'm sure we can solve it technically, because there is a solve for all this, how long it would have taken. So these feature sets, if you're able to churn on a bi-weekly basis, it's because of the flexibility and the capabilities that the cloud provide.
Before you go, one thing here to give a bigger context. These are two, when we started, we looked at the problem and we said, hey, let's split this into the problem set. Let's split this into 4 areas of focus. And we said the consumer. That is the folks who want to come in, and then after they've been in. That's one thing, one area. And that's mostly the mobile app there. And then it's the patient. So they're in, what do we do for them in terms of digital? Right? The third one is really on the provider side, the physicians, for the nurses, what kind of capabilities, digital capabilities we give them beyond just the EMR. And for the electronic medical record systems, for those of you who are familiar with that, that's a pain point for the providers, for the physicians, the clinicians. And so that's a third area. And the fourth one is really all the operational side of things. Now, you may say, okay, 4 things. In reality, we're really the part of the same continuum. Makes sense, right? It was just a split by categories, so we can actually manage them better. But for the consumer, the patient, it is the journey that is important, the entire journey. So that's why when you hear conversations about telehealth versus in person, that's actually not right. It's and, not or. Sometimes you do telehealth, sometimes you need to be in person, sometimes you do telehealth while you are in the hospital. So those are ands, not. But each one of those journeys, whether it's for the consumer or for even the providers, at some point that they interact. We're adding in the mobile app, actually we just added it, it launched the version today, the ability to record, and it's a patient journal, record what you've experienced. That will be sent eventually to the provider so they understand before they meet with you what happened, what did you experience since they last saw you. That's where the two journeys interacted, the 2 digital tools interact better. But that's work in progress.
All right, last but not least, from a capability perspective, analytics. So you can imagine the importance of data and analytics, especially from a healthcare perspective. We want to know how long a patient is going to stay based on the conditions he has. We want to know how long who is more prone to specific conditions versus others. So all of this is possible with respect to machine learning and capabilities if we have all the data structured in a central place. The challenge that we have today is it's siloed and disconnected data sources that exist on-prem, from which any insights is time-consuming. It takes a whole lot of effort to gain any insight, and we are not able to gain anything timely. That we are moving into the data platform in cloud, leveraging S3, Athena, and Redshift, the typical players in an analytics platform.
Well, that was at least before yesterday's keynote, because maybe there's a lot more that we need to put in there.
So those are essentially the major use cases of what we are working on, which facilitates or complements the.
Yeah, and this is an example. Between these 2 slides, the analytics, and earlier you saw the digital experiences, the digital tools. Those are not obviously disparate. And then on the digital side, the more you do, the more you put in the mobile app or the web or what have you, Yes, you have more functionality, but it's more difficult for users to navigate fluidly, especially when they're probably under some sort of duress, pain, or whatever. This is where the analytics and the machine learning can bring in the smarts into, based on the data that we have, the smarts into those digital experiences that basically says, I know what exactly what's happening now. I'm going to try to give you the best that you need right now, not a long list of features and menus, that sort of thing. So that's where these kind of intersect as well.
Yeah, I think the platform will serve as the foundation, as Tony mentioned. We will be collecting a whole lot of information from the consumers. Many of, or most of the patients today have smart watches and equivalents, Apple Watch, Apple Health, where we can pull in that information and gain valuable insights. So if you are presume a case where you are a hypertension patient and you have the habit of taking your BP readings every day, that information, you are pulling it to Apple Health. As a health system, if we are able to pull that information and do some machine learning on it and say that, hey, this patient has increased BP because of certain conditions, the doctor can then use that information to give the right medication to the patient. So that's where the platform and the data comes into play. With that, I will open to questions.
Just one question I have on the overall business case. In order to facilitate all the migrations that you've done, did you have to self-fund through saves, or was it top of the house, fully funded to help with the drive?
It was we basically put together the proposal, and it was positive. The CBA was positive. We did go and ask for money, to fund the migration. You can do out of savings. It's, in my experience, I've done something like that, not for cloud, but for other things, especially upgrades and updates and of systems. It probably takes a little bit longer to execute on that in that context. But we were either one would work. We went to the board and we asked for the funding, showing where, yes, this is what the investment is. This is the bubble for the dual cloud and on-prem. Then we go down, and eventually over 5 years, which would be the age of equipment you refresh the data center. Over 5 years, you're better off and continuing beyond that.
Yes.
Sort of on a related point, was it hard? I often find, how do you know what your spend on cloud is going to be with all of these services that you use? It's something that, as an architect, a lot of times, it's a chicken and the egg thing. You don't know. So, just how did you guys think about that? You were like, because after a couple months, you're like, oh, then we could run some optimizations. But how do you think about, well, in a year or two, what our spend is going to look like on AWS in terms of cloud?
I think from a migration workload perspective, you have tools that you can leverage to build that model, where they look at what your on-prem footprint is, and then they marry that to how it will be on a cloud, right? So that's a easy proposition because you have some reference there. For a net new build, we bake that in as part of each initiative. So what we build becomes part of that cost for that feature. Yes.
So a lot of healthcare providers are very concerned about putting their PII data on the cloud. How did you overcome that?
Yeah, that comes up a lot in all the conversations. And we talked about security, and the capabilities that we get from the cloud providers are HIPAA compliant. So that's number one. Number two is, on top of that, how secure is the data with all the PHI and meeting HIPAA? It's up to us. It's a matter of protecting and defending that information, that data, and the systems, and that's no different than the on-prem. And frankly, on-prem, I don't know if a lot of health systems invested enough in on-prem security over the years, especially with acquisitions and all sorts of other things like that, that they could say, oh, I'm concerned that the cloud is less secure than my data center, realistically. But anybody can do that evaluation. But yes, the cloud can be scary. You put a bunch of PHI data in a bucket, and somebody flicks that tag that says open to the internet. That's bad. But also there are a bunch of other tools that can protect better through automation compared to what you have in the data center.
I think the ecosystem of tools is better in a cloud environment than what you can get in an on-prem footprint, right? So that proves you have way too many things that you can configure to prevent things from going wrong.
Yes, go ahead.
My question has to do with your staff skill transformation. They're doing a lot of new things here, and 20,000 employees. I'm curious as to what is the hardest skill to acquire in training?
So I think from a training perspective, we are following same approach that anybody would, right? So you get some talent from outside, you pair them up with the existing pool, and then cross-train. So I'll take an example of the migration. So in my migration factories, what I have is I have an internal migration factory, which is composed of teams that are internal. Then I have migration factories that are made up from SMEs from outside. So these factories have the resources as a combination. It's not one is the SME pool and one is the internal pool. I mix and match the pools. And the internal resources keep on rotating. So we get 5 resources for one schedule. They go back, we get next 5, and that's the... And from a training perspective, we have been going through immense training with the help of our partners with AWS for almost 4 months now. We have weekly sessions, giving them at least a high-level overview of the capabilities. But you can always tell people, unless they get their hands dirty, they wouldn't learn. So that's where the model of migration is helping a bit. Not yet.
But eventually all the systems will be.
Yep.
We should say there will be some systems that will stay inside hospitals simply for proximity, but most of the others will be there.
Yep. Yep. For the data architecture, Shah here can speak more better than me because he owns data. The challenge is essentially, I mentioned, right? You have to know where your data exists before you can create the consolidated data set. So I think that excavation is the biggest challenge. You don't know what you don't know. You have very disparate and disjointed ecosystem where you have to go and figure out what data exists where and build that data catalog. That's the biggest challenge. not implementing that architecture. That's straightforward and simple. It's straight up in cloud, you go and you can build that architecture. But how do you get the right data there so that we can leverage that?
See, the lights it's dark and the lights are so intense, like we can't see. Anybody else? Any other questions?
Yeah, I'd like to ask one more question.
Go ahead, please.
One of the slides you talked about optimizing your ETLs and your integrations. Can you talk a little bit about your approach on that and what you felt like the critical parts were in reevaluating?
Our current ecosystem is dated with respect to ETLs and tools and capabilities. So we are essentially looking at replacing that technology altogether and rebuilding that from net new. Because the way it is architected today, there is no way no hope that we can move that as is into cloud. So that's where some of the net new capabilities you saw there in terms of glue and likewise, which is going to help. But there is a decent amount of effort involved there where we have to look at how it is implemented today and change it to how we want it to be.
Yeah, this is where I was saying earlier is migrations like these offer the opportunity to also do things somewhat unrelated. So there's a whole data initiative that Shah is driving that it's absolutely uses the capabilities in the cloud because there are so many. But even without the cloud, in a strange world without the cloud, we would have gone that route if the technologies were available because of the demands of what do we want to do with the data. And it just so happens that these tools are available. But, we would be doing whatever it is on-prem. Fortunately, we don't have to, but yeah.
Thank you very much.
What was your timeline, the number of applications that you
Are moving. Yes.
We have around 600 odd applications, and the promised timeline is 2 years, and I'm trying to get it under a year.
600 applications, yeah. Now, in fairness, some of them are simpler. Some of them will turn out to be pretty complicated. All hospitals have one of the biggest capability is the imaging, X-rays, scans, all that stuff. That's going to be interesting hybrid solutions just for the latency part, and that will require a lot more re-engineering than some applications. But that's where somewhere we've shown you, how you split the applications, how you categorize, and you say, yeah, this one is going to go to that architecture reference architecture, and will take this much effort versus this one, which will be a lot different.
Anybody else? The question is really, healthcare systems are very fragmented. So many systems. Do you think some issues need to be worked at industry level versus having every hospital do it? No hospital can afford to own everything.
You're absolutely right about the fragmentation, and unfortunately, that continues because it does provide advantages to the vendors. And you have all these not this conference, but conferences in healthcare where those vendors, they say, oh, here's my gizmo, super gizmo, Rockstar, whatever, just plug it in and everything will be good. But it's a very extremely narrow piece of functionality that won't work well. And now, 6 months from now, you're going to get something else, and on and on and on. You're absolutely right. At the broader level, I don't know what could be done, but you're right. There are some things that maybe we get together, the systems get together, I don't know if with the government or not, to solve some of these problems. And actually, some of that happens as well, with the interoperability standards that actually the government is promoting. But on the architecture side, it is something that we should kind of get together to. And some of the architectures that we see are probably 15 to 20 years behind what you see in other areas, even for basic things, how you do, data storage. And so maybe that's something we need to do to change that architecture situation with those vendors.
We are in the process of implementing that. The workloads have not been migrated yet. So.
All right.
Very good.
I don't think there's any other question, but we're going to be here. Thank you.
Thank you.